Hello class, my name is Cassidy Moore and today I'll be giving my leadership symposium over burnout in healthcare. The article I'm using is titled 10 Bold Steps to Prevent Burnout in General Internal Medicine, and it was written by Mark Linzer, Rachel Levine, David Meltzer, Sarah Poplow, Carol Ward, and Colin P. West. This article was published in September of 2013 into the Journal of General Internal Medicine. This article is related to our class because burnout is something that affects interactions and communications between providers and patients. As we discussed earlier in the semester, burnout can lead to a decrease in empathy, which leads to a more negative experience for patients and decreased quality care. I would like to start by summarizing this article. They determine burnout as a long-term stress reaction, which includes emotional exhaustion, depersonalization, and a lack of sense of personal accomplishment. They then describe physician burnout rates, which range from 30 to 65%, with the highest rates experienced by those at the front line of care. This front line of care includes this topic of general internal medicine. Some other facts that they presented are women are 60% more likely to experience burnout than men, and physicians that experience burnout are more likely to leave their practice, which can cause a replacement fee of around $250,000. I'm now going to very briefly describe the 10 steps that are suggested in this article. The steps are broken into 4 different categories. The first category is institutional metrics. Step 1. Make clinician satisfaction and well-being quality indicators. Success of an institution is dependent on the satisfaction of its employees. Predictors of poor clinician outcomes can be used to prevent burnout rates. Step 2. Incorporate mindfulness and teamwork into practice. Mindfulness is known to internally reduce the effects of external stressors, and teamwork spreads out the workload, also decreasing stress. Both of these are means of reducing the physician's overall stress and burnout. Step 3. Decrease stress from electronic health records. This step is needed due to the increase in computer work required for physicians to fill out, as well as after-hour communications with patient portals, which are becoming more and more popular with organizations. Ways to decrease stress from electronic health records would be to make visits longer to give more time to fill out the computer work, or to have time built into the schedule specifically for computer work. The second category falls under work conditions. Step number 4. Allocate needed resources to primary care clinics to reduce healthcare disparities. They suggest addressing challenging conditions, especially in organizations that have many minority patients, by obtaining sufficient clinical resources, more room availability, and access to specialists. Step number 5. Hire physician floats to cover predictable life events. Life events can lead to a shortage of physicians when physicians have to take off, so planning ahead with a float pool coverage can prevent overworking physicians when they are short on staff. Step number 6. Promote physician control of the work environment. Due to standardization practices in many healthcare organizations, physicians have less control over work. The high levels of stress associated with their career can be decreased if they are given some control over work. Therefore, it is important to preserve work control for physicians. Step number 7. Maintain manageable primary care practice sizes and enhance staffing ratios. Spreading out the workload and having enough people to cover everything would reduce stress and therefore reduce burnout. The third category is career development. Step number 8. Preserve physician career fit with protected time for meaningful activities. Balancing clinical work and time off can help to prevent burnout by allowing physicians time to do what they enjoy most. Step number 9. Promote part-time careers and job sharing. Part-time physicians have a more flexible career and are satisfied. They are less likely to leave their jobs than full-time physicians. Job sharing is also more flexible and helps to create a better work-life environment balance. One study showed that U.S. physicians with the highest work-life balance had the lowest rates of burnout. The last category and the last point fall under self-care. The last step that they suggest is to make self-care a part of medical professionalism. Due to the fact that physician distress has a negative impact on themselves and their patients, they suggest that professionalism needs to include how physicians care for themselves, along with altruism and a compassion for helping others. Now, I did find several things that were done well in this article. One of them is that they gave thorough reasoning as to how each step suggested was related to burnout and why it would help in preventing burnout. I also think the organization techniques that they used by breaking up the different steps into different categories made it easier to read and kept interest. One thing that I think they could have improved on was that they didn't give much detail on how to implement the steps that they were suggesting. Some steps had brief examples of things that could be done, but I would have liked to see more detail to make it easier to put the steps into practice. Lastly, I would like to ask a few questions. Do you find burnout to be a significant issue in healthcare? Are any of these steps already being used where you currently work? If so, which ones? Which of these ideas would you like to implement at your practice? And are there any ideas that you don't think would be beneficial to preventing burnout? To conclude my leadership symposium, I would like to thank you all for your time. I hope you have found this topic to be as interesting as I did, and I look forward to reading your responses. Thank you.